Ever wondered why measles, once eliminated in the United States in 2000, has made a surprising comeback? The answer lies in a combination of global travel and vaccination rates. But before we delve into that, let's first understand what measles is and how it manifests itself in the human body. Measles is a highly contagious viral illness spread through direct contact with respiratory droplets. Its transmission rate stands at a staggering 90%. The symptoms include high fevers, a distinct rash that spreads from the head to the trunk and extremities, and the presence of Koplik spots, which are clustered white lesions on the buccal mucosa. These symptoms are accompanied by the 3 C's: cough, coryza, and conjunctivitis. The incubation period averages between 10 to 12 days, with symptoms appearing around 7 to 14 days after exposure. The complications of measles range from common issues like diarrhea and otitis media to more serious conditions like pneumonia, hepatitis, pancytopenia, and thrombocytopenia. The most concerning complication is subacute sclerosing panencephalitis, a rare and universally fatal neurologic degenerative complication that presents with dementia and neuromuscular disorders around 7 to 10 years after the measles infection. But why the resurgence in 2024? 2 main factors contribute to this. Firstly, measles is still endemic in many parts of the world, and when Americans travel to these regions, they inadvertently bring the virus back home. Secondly, the virus then spreads among unvaccinated individuals in the US. For patients who show classic measles signs but are not severely ill, it's crucial to inform the health department immediately. They will assist with self-quarantine instructions and initiate contact tracing for potentially exposed persons. The treatment for measles primarily involves supportive care and quarantine, as the patient remains infectious from 4 days before symptoms onset to 4 days after the appearance of the rash. The measles vaccine is incredibly effective, with a 93% protection rate after the first dose and a 97% efficacy after the second dose. The CDC recommends that infants aged 6 to 11 months receive 1 dose of MMR vaccine, while those aged 12 months or older should receive 2 doses, separated by a month. Adults who have received only 1 MMR vaccine should get a second dose. For individuals who choose not to vaccinate, it's important to understand that measles is not benign. Prior to the vaccine, hundreds of children died in the US due to measles. The vaccine is safe, effective, and the only barrier between a population and a measles outbreak. Globally, 14 people per hour die from measles, with the death rate standing at 1 to 2 per 1,000 cases in developed countries and 1 to 2 per 100 cases in developing countries. In summary, measles is a highly contagious, dangerous disease that can be effectively prevented with vaccination. Despite being eliminated in the US in 2000, it has made a comeback due to travel from endemic regions and lower vaccination rates. Protect yourself and those around you by getting vaccinated, and always be mindful of the symptoms and complications associated with this disease.